Hello guys, today we'll learn about ECG, the basics of the leads. The ECG actually tells you about the electrical activity of the heart, which is recorded on a paper with a speed of 25 millimeters per second. It consists of boxes, large box and small box. The large box consists of small boxes. The 5 small boxes are included in one large box. The small box tells you about it that it is of 0.04 seconds and the large box is of 0.2 seconds. There are 12 conventional leads in a 12 lead ECG, which are usually divided into two groups: the frontal plane leads and the horizontal plane leads. These are the main two groups: the frontal plane leads and the horizontal plane leads. Now, the frontal plane leads are further subdivided into lead 1, lead 2, lead 3, and AVR, AVL, and AVF. Then, further, these frontal plane leads are divided into the standard leads and the unipolar leads. The standard leads and the unipolar leads. Now, the standard leads are mainly placed on extremities, that is on the right arm, on the left arm, and on the left leg. So these are placed on the right arm, the left arm, and the left leg. And the unipolar leads are AVR, AVL, and AVF. And the horizontal plane leads are from V1 to V6, which are placed on the chest of the patient of which we are recording the ECG. So let us see the diagrammatic presentation of the small standard leads. The standard lead 1 is present on the right arm and the left arm, and it measures the deflections which is recorded on the ECG machine. If we see from the heart point of view, then mainly if you see, it is from the right to left, so it is on the above surface of the heart and tell the deflections of the right and left. Now let us see about the standard lead 2, which is present on the right arm and the left leg. The negative pole on the right arm and the positive pole on the left leg, which will tell you about the deflection from these two. Okay, now let us see from the heart point of view. So from the right arm, it is placed above and the left leg placed below, and the electrons flow from negative to positive charge. Now let us see about the standard lead 3. The standard lead 3 is mainly placed on the left arm and the left leg and tells about the deflection from these two from negative to positive. And if we see from heart point of view, it is present on the left above side and the you can say the left interior. Okay, so this is the way in which the leads are placed. Now let us see about the unipolar leads. The unipolar leads are the AVR, AVL, and AVF. These are always termed as V. So the unipolar leads, which are mainly placed on the extremity or records the precordial as well. The extremity leads have very low electrical potential. Okay, so all the extremity leads have very low electrical potential. Then due to this low electrical potential, these are augmented by the instrument. And that's why the prefix A is used before the leads, that is the AVR, AVL, and AVF. So we use the prefix A before this. Now let us see what is AVR, AVL, and then AVF. The AVR, A corresponds to augmentation, that is the augmented part, and R represents to the right arm lead. Okay, so there's a note. What's the note? All the limbs can be viewed as extension of the torso, so it is immaterial whether the electrode is placed on the wrist, arm, or shoulder, as in the case of amputation. Now, in the AVR, the A is the augmented and the right arm, and the AVL is the augmented, left is the left arm, and the AVF A is the augmentation, and F tells you about the foot, that is the left leg. So, from here we can see that. Let us see it with the help of a diagram. The AVL records from the right arm, the AVR from the right arm, the AVL from the left, and the AVF from the left foot. And if we see with respect to the heart and the arms, the AVR is to the right side above, the AVL to the left side above, and the AVF to the left side below the heart. In this way, we can judge that which part of the heart is involved and which lead is corresponding to which part of the heart. The AVR is usually negative because it shows the negative deflection because it is oriented mainly towards the chamber of the heart. The AVL, it oriented mainly to the anterolateral part, as we can see in the diagram also. So it tells you about the anterolateral part of the heart. The AVF, it tells you about the inferior part of the heart, which is oriented to the inferior surface of the heart. So AVR, AVL and AVF there can be clearly viewed from the diagram. Now let us see about the lead 1, lead 2 and lead 3. The lead 1, as we can see, it is mainly placed above the heart. So it tells you about the superior or left lateral wall of the heart, the condition of the superior left lateral wall of the heart. The lead 2 and lead 3, as we can see, as per the location of the heart, the lead 2 tells you about the inferior wall because the electrons flow from the negative to positive direction, and lead 3 as well of the inferior wall of the heart, which is clearly visible in the diagram. Now after that, we move to the horizontal plane leads, which are also known as the precordial leads or the chest leads, which are V1 to V6. Now, how do we place? How do we place these? The V1 is placed at the fourth intercostal space just to the right of the sternum. V2 is placed just opposite to V1 at the fourth intercostal space left to the sternum. Now, we don't place V3, we will usually place V4. The V4 is placed on the fifth intercostal space in the mid clavicular line, and in between the V2 and V4 we place the V3. Then after V4 we place V5. V5 is at the same horizontal level as V4 on the anterior axillary line. Okay, and then V6, which is on the same plane as V4, and V5 at the mid axillary line. Usually, as I told, electrons flow from negative to positive. That's why you have to understand this. Now if we'll see the diagram of the heart, we can see the septum, the left wall is a bit thicker and the right wall is a bit thinner. Now we have placed V1, V2, V3, V4, V5 and V6, and we can clearly see that V5 and V6 are mainly corresponding to the lateral wall of the heart, and V1 to V4 are mainly corresponding to the anterior and anteroseptal wall of the heart, which is very much clear from the diagram. So what we have to note is that there is no lead which is oriented directly to the posterior wall of the heart. The ECGs tell mainly about the inferior and anterior and anteroseptal walls. So to overall summarize this, to understand which leads tell you about which part of the heart and how it is placed, which I have already discussed, the lead lead 2, 3 and AVF tells you about the inferior surface of the heart. The lead 1 and AVL will tell you about the superior or left lateral wall of the heart. The V1 to V4 tells you about the anterior or anteroseptal wall of the heart. And then finally V5 and V6, which tells you about the lateral wall of the heart. So guys, I hope I have cleared the basic principles of the leads, which you can understand how leads are placed and how these are oriented towards the heart. Thank you.